Welcoming a newborn into the world is a joyous occasion, filled with wonder and excitement. As you navigate the early days of parenthood, you'll learn to care for your little one's every need. One common condition that often arises during this time is newborn jaundice. Don't worry, it's usually harmless and easily treatable. Let's understand what jaundice is all about. Jaundice is a yellowing of the skin and the whites of the eyes. It happens when there's too much bilirubin in the baby's blood. Bilirubin is a yellow pigment that's made during the normal breakdown of red blood cells. Most babies have a little jaundice in the first few days after birth. This is called physiological jaundice. It's usually mild and goes away on its own. In fact, about 60% of full-term babies and 80% of premature babies get jaundice. So, you're not alone if you notice your baby's skin looking a little yellow. As a new parent, you're constantly observing your baby, learning their cues and quirks. Recognizing the signs of jaundice is important. Early detection helps ensure prompt treatment if needed. The most obvious sign is a yellowing of the skin. This usually starts on the face and head and then spreads down to the chest, belly, arms, and legs. The whites of the eyes may also look yellow. To check for jaundice, gently press your finger on your baby's forehead or nose. If the skin looks yellow where you pressed, it could be jaundice. Other signs to watch for include dark urine, which should be clear or pale yellow, pale stools, which should be yellow or greenish, lethargy or difficulty waking up, and high-pitched crying. If you notice any of these signs, it's important to contact your pediatrician. Understanding the causes of jaundice can help alleviate any anxieties you might have. Jaundice is a common condition in newborns, and while it can be concerning, it's usually not a cause for alarm. In most cases, jaundice occurs because a newborn's liver isn't mature enough to remove bilirubin from the blood efficiently. Bilirubin is a yellow substance produced during the normal breakdown of red blood cells. Here's a breakdown of the common causes of jaundice in newborns, which can help you understand why this condition occurs and how it can be managed. Physiological jaundice is the most common type, occurring in healthy babies. Their livers are still developing, leading to slower bilirubin processing. This type of jaundice typically appears 2 to 4 days after birth and usually resolves on its own within a week or two. Breastfeeding jaundice occurs in some breastfed babies during the first week of life. This can happen if they're not getting enough breast milk, leading to dehydration and slower bilirubin elimination. Ensuring the baby is feeding well can help reduce the risk of this type of jaundice. Breast milk jaundice is less common and starts a few days after birth. It's thought to be caused by substances in breast milk that make it harder for the baby's liver to process bilirubin. This type of jaundice can last for several weeks, but is usually harmless. Blood type mismatch can also cause jaundice. If the mother and baby have different blood types, the mother's antibodies can cross the placenta and break down the baby's red blood cells, increasing bilirubin levels. This type of jaundice often requires medical intervention. And finally, other medical conditions can also lead to jaundice. In rare cases, jaundice can be a sign of a more serious underlying medical condition, such as an infection, liver disease, or a blood disorder. These conditions require prompt medical attention and treatment. Remember, it's always best to consult your pediatrician for an accurate diagnosis and appropriate treatment plan. Early detection and management can help ensure your baby's health and well-being. Diagnosing jaundice is usually straightforward and simple. Your pediatrician will examine your baby's skin and eyes for any signs of yellowing. They'll also ask about your baby's feeding patterns, urine and stool color, and overall behavior. To confirm the diagnosis and determine the severity of jaundice, a simple blood test called a bilirubin test may be performed. This test measures the level of bilirubin in your baby's blood. For accurate results, the bilirubin test is usually done with a heel prick. A small amount of blood is collected from your baby's heel and sent to a laboratory for detailed analysis. Section 5. Treatment options, helping your baby recover. The good news is that most cases of newborn jaundice resolve on their own within a week or two. This is because a newborn's liver matures and becomes more efficient at processing bilirubin, the substance causing the yellowing of the skin and eyes. However, treatment may be necessary if bilirubin levels are high, or if your baby is showing signs of worsening jaundice. It's important to monitor your baby's symptoms closely and consult with your pediatrician if you notice any changes. Here are the most common treatment options that your healthcare provider might recommend. Phototherapy, light therapy. This is the most common treatment for jaundice. It involves placing your baby under special blue lights that help break down bilirubin in the skin, making it easier for your baby's body to eliminate it. Your baby is placed under these lights for several hours a day, and the treatment is usually very effective. In some cases, a fiber optic blanket may also be used in conjunction with the lights. Intravenous immunoglobulin, IVIG. In cases of blood type mismatch, IVG may be given to help reduce the levels of antibodies in your baby's blood. This treatment can prevent the breakdown of red blood cells, which in turn reduces bilirubin levels. Exchange transfusion. This is a rare treatment reserved for severe cases of jaundice that don't respond to other treatments. It involves slowly removing small amounts of your baby's blood and replacing it with donor blood, effectively reducing bilirubin levels. This procedure is typically done in a neonatal intensive care unit, NICU, and is closely monitored by medical professionals to ensure the safety and well-being of your baby. Your pediatrician will determine the best course of treatment based on your baby's age, overall health, and the severity of jaundice. Always follow your healthcare provider's advice and ensure regular follow-ups to monitor your baby's progress. Section 6. Home care for jaundice, supporting your little one. While medical treatment may be necessary in some cases, there are also things you can do at home to help your baby recover from jaundice. These simple yet effective measures can make a significant difference in your baby's health and comfort. Here are some practical tips that you can easily incorporate into your daily routine. Frequent feedings. Breastfeed or bottle feed your baby every 2 to 3 hours to encourage frequent bowel movements, which helps eliminate bilirubin. This frequent feeding schedule ensures that your baby stays hydrated and nourished. Sunlight exposure. Sunlight can help break down bilirubin in the skin. Place your baby in a well-lit area near a window for short periods. The natural light aids in reducing jaundice levels. However, avoid direct sunlight, as it can be harmful to their delicate skin. Always ensure that the sunlight is indirect and never too harsh. Monitor diapers. Keep track of your baby's wet and dirty diapers. This helps you monitor their intake and output, which is crucial for their recovery. Frequent urination and bowel movements are good signs that they're getting enough milk and eliminating bilirubin effectively. Keeping a diaper log can be very helpful. Skin-to-skin contact. Holding your baby skin to skin can provide comfort and warmth, promoting bonding and relaxation. This close contact can also help regulate your baby's body temperature and heart rate. Remember, these home care tips are not a substitute for medical treatment. They are meant to complement the care provided by healthcare professionals. Always follow your pediatrician's guidance and seek prompt medical attention if you have any concerns. Your baby's health and well-being are the top priority, and professional advice is invaluable. Section 7. When to worry. Recognizing potential complications. While most cases of newborn jaundice are harmless and resolve easily, it's essential to be aware of potential complications. Early detection and timely intervention are crucial in preventing any long-term problems. Here are some red flags to watch out for. Jaundice that persists beyond 2 weeks. Yellowing of the skin that spreads rapidly or becomes intense. Lethargy, poor feeding, or difficulty waking up. High-pitched crying or irritability. Fever or other signs of illness. If you notice any of these signs, don't hesitate to contact your pediatrician immediately. Prompt medical attention can help rule out any underlying medical conditions and ensure your baby receives the appropriate care. Remember, it's always better to err on the side of caution when it comes to your baby's health. Trust your instincts and seek professional medical advice if you have any concerns. Section 8. You've got this. A message of reassurance. As a new parent, dealing with newborn jaundice can feel overwhelming and stressful. It's important to remember that you're not alone and that this is a common condition with effective treatments available. By following your pediatrician's guidance and providing your baby with love and care, you can help them recover quickly and thrive. Trust your instincts, stay informed, and don't hesitate to reach out to your healthcare provider if you have any questions or concerns. You've got this.